This isn't a case of debating overdose. This is a case of saying, was it higher than you would expect for the achievement or production of adverse side effects? It clearly is. Then looking at the evidence and saying, was there decisions or behaviors or actions that would be consistent with the intoxication of MDMA?
All right. And so based on that, you were able to, like you said, read all the reports, witness statements, watch the video. What were the specific actions that you felt that correlated with the symptoms of the MDMA?
Yes. So I would, if you want to go back to the previous slide. Previous. I think this helps to. In total, this was the appearance or impression of questions that I had, clinical observations, from watching the same evidence. And that was one, we saw that Mr. McLaughlin went outside and left his child behind with strangers in the store. So that was, at that juncture, he didn't know the severity or totality of what was happening outside, but left his child behind. If the video shows, there was no adults around within seconds. The number two was displayed instant physical and behavioral aggression without provocation. Within 8 to 10 steps out the front door, there was no dialogue with Ms. Jacobs to discern who started, what was being said, what the nature and intensity was. There was no discussion with Mr. Drake either. There was just a physical assault, a significant one that dropped him to the ground. After that, there was also no assessment of the situation for additional risk factors. Were there more than one person around the car? Were there other risk factors? Also, the assault and the individual without consideration for the family and the children. Like, was there someone already with the children, and attacking Mr. Draco would be produce a different outcome for the family. And then after that was after having been shot, he left the children and his girlfriend in the car, and went back into the facility. So I do appreciate he had been shot and was doing some type of retreat, but if the intent was to protect Brittany and the children, it was an opposite effect of what you would expect.
And then ultimately, you came up with two opinions in this case, correct? And what were those two opinions?
The first opinion was that on 7/19/18, at the time of his death, that Marquise McLaughlin had substantial amounts of two impairing and intoxicating controlled substances in his system, MDMA and one of its pharmacologically active metabolites, MDA, in his system, which is indicative of it recent ingestion, and within that time frame that correlates with intoxication and effects. On 7/19/18, at the time of his death, Marquise McLaughlin behavior and actions appeared consistent with known and reported adverse side effects of MDA and MDMA and MDA, specifically including confusion, impulsivity, agitation, aggression, emotional instability, or altered perceptions.